to Road Gang Radio with Jimmy Mack, Lindsay Lawler.
Give me a minute, y'all. I'm coming.
And you, because if you're listening, you're in the gang. Take it away, founding member Phone Master Dre.
Woo, I like the sound of that. Take it away, Dre, and take it away, Jimmy, because this is Road Gang Radio live from Fastport Studios.
Hey, by the way, this guy's showing up to help bring things down. And I don't mean down as in a bad mood. I mean things down as in your cholesterol levels. Dr. Lloyd-Jones received a BA from Swarthmore College, an MD from Columbia University's College of Physicians and Surgeons, and a Master of Science in Epidemiology from the Harvard School of Public Health. Did his internal medicine and cardiology training at Massachusetts General Hospital, served as medical chief resident, chief cardiac fellow. He was a fellow and then a staff researcher at the Framingham Heart Study from 97 to 2003. And in 2004, he joined the faculty at Northwestern University's Feinberg School of Medicine, rising to become Eileen M. Fohl Professor of Heart Research and Professor of Preventive Medicine, Medicine and Pediatrics. He served as chair of the Department of Preventive Medicine at Northwestern from 2009 to 2024. He grew the department from 27 to 82 full-time faculty. And in 2025, he moved to Boston University School of Medicine, where he is currently the Alexander Graham Bell Professor, Director of Framingham Center for Population and Prevention Science, PI of the Framingham Heart Study, and Section Chief of Preventative Medicine and Epidemiology in the Department of Medicine. It is an absolute pleasure to welcome him here today during, it's National Cholesterol Awareness Month. And Dr. Jones, it's great. Lloyd-Jones, it's great to have you here. How are you?
Well, gosh, thank you for that overly extensive introduction. It is great to be with you guys. Please call me Don.
Don, thank you so much for that courtesy extended. Really appreciate that. I wanted to read all of that because, as you know, simple as people think this topic is, I wanted people to understand this is a very serious conversation. And I was talking to Dave Nemo about this yesterday. I think a lot of folks out there don't really understand how under the radar cholesterol levels are flying right now, is that people are focused on so many other things that they're really not paying as much attention to it as they used to. Please tell me I'm wrong, but my impression is that people are not focused on this in the way they used to be.
No, unfortunately, I think you're absolutely right. I'll say dead right, because unfortunately the consequences of high cholesterol, or let me say that a little differently, cholesterol that's too high for you, can be deadly, right? Cholesterol, especially the bad cholesterol particles, are the central molecule that get plaques started in our arteries. And those plaques ultimately are what can turn into heart attacks and strokes. So it's incredibly important for people to know their numbers and understand whether those numbers are okay for them or whether they're too high and we need to get focused on them.
And that's kind of the way we kind of begin. You know, it's interesting that I don't know if you know this, but on Tuesdays here on Radio Nemo, what we do is we actually talk to the head of TA and Petro's, maintenance department about people's rigs and trucks, and then we have Highway to Health. So much of this is really based on understanding what your equipment, where it is right now, and then based on that, figuring out ways either to maintain that or to make the necessary adjustments. So the best place to begin is with the numbers, right? I mean, it's to go see your doctor and get a clear sense of where you are. What does that entail?
Yeah, I love that analogy. It's exactly right. You know, you got to know what the state of your equipment is. Unless you check, you don't know what your oil level is. Unless you check, you don't know what your cholesterol numbers are. This is completely silent. It requires a blood test. And for most people, that doesn't even have to be a fasting blood test anymore. You don't have to, fast or not eat for 8 to 10 hours. You can get it done same day in the office, even if you've, eaten breakfast that morning. We wouldn't do it immediately after a triple cheeseburger, but other than that, we can get very reliable numbers, if people have eaten, pretty normal meal even within the last couple hours. So don't be shy about asking your doctor to get the lipids checked today, because it can be done in almost everybody.
Let me ask you this too, because and please, you're the expert here, so correct me when I get this wrong. We've discovered that different people need different amounts of sleep. Different people can eat different things, and it has different impacts on them based on who they are. In regards to the lipid test, in regards to that, Are there certain numbers that set off bells and whistles, or is this one of those things that a lot of other stuff has to kind of go into figuring out where you are? Or is this a pretty clear, like across the board result? We'll tell you what's happening here.
No, it's really important to acknowledge everybody's different. We all inherited a different mix of genes that determine how efficient or how effective we are at absorbing fat in our diet or cholesterol in our diet and getting that into the bloodstream. And it's really the cholesterol levels in the bloodstream that matter. Some of us, as I said, are kind of particularly good at absorbing fat that we've eaten in our most recent meal. And that means we might have higher cholesterol blood levels related to what we're eating than somebody else. And there are other people who are pretty resistant to absorbing fat in their diet. And they're the lucky ones, right? Where they could get away with eating more eggs, or they might be able to get away with it. But you can't tell that just on your own. That requires work with your doctor and looking at your cholesterol levels over time to determine, is diet going to really, really help you, or is it going to be less helpful and we might need to move to medications earlier if your cholesterol levels are high?
All right, let's talk about, like I said, if your numbers come back on the lipids and you're looking good, then it's going to be a matter of, let's talk about what you're doing, and provided it doesn't sound completely insane, your doctor's going to be like, okay, so more of that, just keep up with it and keep on coming in for your regular checkups. But let's talk about the moment that too many Americans get where, hey man, this level is too high. Where are the beginning steps that we can begin to take? Because, and once again, correct me if I'm wrong, this is one of those things that with some serious intervention quickly, you can really turn this around in a hurry, right?
Absolutely right. I think what people often don't get, and we've done a bad job of kind of providing this information, I think, is the context really matters. There is no normal level of cholesterol. I hate that word because for some people, if they smoke or have diabetes or high blood pressure, their cholesterol level needs to be much lower than somebody who might be, really young and healthy and have no other risk factors at all. We can tolerate a little bit higher cholesterol levels in those people. So your individual context really matters. That's where the conversation with your doctor about, are these numbers okay for me? Not just, are these numbers, quote, normal, right? There is no normal. We need to make sure that they're optimal for you and your individual situation. Once you've determined that, if you need to work on lowering especially your bad cholesterol levels, the so-called LDL cholesterol.
Do we lose you? Don, are you there? We're going to check this real quick. I think you might have hit a mute button. All right, we'll give him a call back here. Sorry about that, Don. Welcome back to the show.
Sorry about that. Where did you lose me?
Basically, we had just talked about the good cholesterol and the bad cholesterol. You were about to dig into that.
Yeah. So, one.
It happened. What's going on, man? Okay. We did it again. Okay, guys, give us a second here. We're going to get Don all set up and kind of squared away. This is an important conversation, by the way, guys, because so much of this, and I was kind of thrilled to hear this based on the reading that I've done, but I always defer to the expert. This is one of those places that, unlike some of the damage people do to themselves with COPD and some of the long-term health effects of diabetes, which can be turned around, but nowhere near as quickly as this can. This is something really kind of special and remarkable, if in fact you work with your doctor, that you can actually really make some positive changes. Don, I'm sorry about this. It's good to have you back. Let's one more time.
Oh, well, I'm so sorry. I will do my best to make sure I don't drop again.
Okay.
So, yeah, we were talking about if the numbers are not optimal for you, we need to think about diet and physical activity as potential ways to improve those numbers. And there are a number of strategies we can use there before thinking about medication.
Let me ask you this, and we'll pivot to diet here in a second, but I wanted to talk about exercise because the diet stuff I really understand. And look, I know exercise overall is good for us. Can you talk about what the impact of a healthy lifestyle regimen, of actually being active and vibrant and out in the world, out at the gym, hanging out with the grandkids, hitting the pool and all that stuff, why does that have a positive impact on our cholesterol levels or managing cholesterol levels?
Yeah. So I think to understand this, we need to talk just quickly that there are sort of three components to our total cholesterol. There's the LDL or bad cholesterol. Those are the particles that can get into our artery walls. There's the HDL or good cholesterol. And then there's the triglycerides, which are sort of the energy-bearing fat molecules that deliver energy to our muscles, but that can also deliver those triglycerides to our fat cells for storage for later. So we look at all three of those numbers. What exercise and physical activity can do for us is it can raise the good cholesterol so that we're hopefully clearing more cholesterol out of our arteries. And it can also reduce the triglycerides pretty dramatically. So triglycerides do contribute to your risk for heart attacks and strokes. And so exercise can help, particularly with the HDL and the triglyceride portion. It doesn't tend to change the bad cholesterol number very much.
Okay, and that's where diet comes, and this is why it's a combination punch. This is the reason why, because while you can actually have a positive impact on what is positive, in order to get rid of what is negative, you've got to get rid of it. Let's pivot now into diet then, and talk about what a good diet to deal with a high cholesterol problem is.
Yeah, if your cholesterol is too high for you, then important features of your eating pattern are to make sure you're getting lots of fiber, lots of fruits and vegetables, whole grain like oatmeal, things like that. Those will all help lower most people's LDL cholesterol. And then, avoiding, if you're someone who's particularly sensitive to this, like we talked about, if you're good at absorbing fat from your diet, then you need to avoid things like fatty proteins, kind of high fat meals, and focus on the healthy fats, things like fry in olive oil, fry in canola oil, eat vegetable fats and try to avoid the animal fats because those are the ones that we tend to absorb and turn into the bad cholesterol.
And can you help me out a little bit here in understanding that too? Why are the animal fats worse for you than, say, like I said, there are people who can, like I said, I want to talk about the idea that there's a lot of wacko diets out there or whacked diets. And I'm not picking on people here, but we hear stuff about the carnivore diet, stuff like that. And, for some people it seems to work, but why in particular do animal fats really have a negative impact on your cholesterol in a way that the vegetable fats don't?
Yeah. So, this is important to understand. Not all fat is bad. There are good fats and there are less good fats. The less good fats tend to be the things that come from, animals that we raise. So fish have good fats in general, but things like pigs and cows generate not so healthy fats. So, the leaner the protein you're eating, the better it's going to be. Fish is a great choice to get healthy fat rather than unhealthy fat. But yeah, most of our land animals that we cultivate have more of the unhealthy fats. These are the saturated fats as opposed to what are called unsaturated fats, which is what we tend to find in fish and in vegetables.
I'm gonna kind of go a little bit personal here with you and just kind of ask about, you have a passion for this. This is something that is beyond just your area of specialties. It is your area of specialties, but you're very passionate about this. Can you talk about why gravitationally you've kind of moved into this area and why you feel like this is such an important thing to focus on? What's kind of the core value for you in all of this?
Yeah, thanks. I'm a cardiologist. I'm a heart doctor, and I've seen far too many patients who've had devastating heart attacks and strokes. This is not blaming them, but, these are things that are preventable. We know what causes heart attacks and strokes, and we could prevent somewhere between 80 and 90% of the heart attacks and strokes that people suffer. And so, that sort of perspective really gets you focused on trying to limit suffering, right, and improve and extend people's lives. So prevention really becomes a core value, as you're saying, and we know that we can do an awful lot with medications, but it has to have a basis of healthy lifestyle. And so we really, really got to get people focused on that from early in life, and it will both improve and extend their lives.
Yeah, and that's kind of the thing too, is that what a lot of people don't understand is while this is quick to turn around, this is one of those things that it also could be too late. Like I said, I mean, this wouldn't take long in the scope of a long life to kind of, really kind of course reset. I mean, matter of fact, could you kind of give us a sense of if you listened to your doctor, God forbid somebody should do that, and took the necessary steps, I mean, how quick can you see a reduction in those numbers?
Yeah. Well, to get to your first point, unfortunately, about a third of people first find out they have heart disease when they die suddenly from a heart attack. And of course, then it's way too late. And that happens to far too many people at too young of an age. So that's why it's critically important to kind of find out, know your numbers, and have a plan. But even beyond that, as you're saying, it really actually is never too late if you've kind of put this plan in place, because you can reduce your cholesterol levels very quickly. Diet can be helpful for many patients that will require a simple medication. One pill a day can often reduce your cholesterol levels by 50%. And that can have a dramatic reduction then in your risk for heart attacks and strokes for decades to come.
I wanted to ask you about the medication. And by the way, I'm not one of those people who fears medication or fears prescription or has any issue with it whatsoever. In many cases when it comes to pharmaceuticals in regards to psychological issues, often people will be given a medication early at one point and then use the time that the medication buys them to make cognitive changes to their lives and wean themselves off of medication. I think a lot of people's concern is one more pill. Is it possible, and by the way, no is fine because it helps you live longer. We're good with that. Is it possible to kind of use some of this medication and then while you're taking the medication to really affect the necessary lifestyle changes? People who are diabetics often have situations like this where they begin to really kind of turn their lives around and begin to be able to kind of move away from simply medical solutions and more towards lifestyle solutions. Is that a scenario here? And am I making sense?
I think for most people, if we decide you need a medication that's going to lower your cholesterol and again, extend and improve your life, for most people, it is hard to get off of that.
Understood.
It's hard to do enough lifestyle to achieve that goal that we could do without the medication. But let me say, I've had patients who have dramatically altered their lifestyle and lowered their cholesterol to the point where we did not need the medication anymore. So this is doable. It's just hard. And so, if we commit to a medication, for most people, that's going to mean, we're going to be treating this for a good part of the rest of your life. Now, that, taking a pill is not something that some people feel great about. It medicalizes something. It makes them feel like a patient. Totally get that. But the benefits can be extraordinary. Again, in extending people's lives and improving it, making sure they don't have a heart attack or a devastating stroke that could really affect their quality of life.
By the way, I want to make this really clear. I asked this question not because I have any aversion to pills or taking medication to make my life better, to improve the quality of my life, but it's my way of reminding listeners right now, if you don't like taking pills, it might be a good time to start making lifestyle changes before that becomes a de facto reality of your life. And that's one of the other things you might want to prevent. There's some really great stats you've given us here, too, because I want people to really understand this. You sent me the Harris poll, some key findings. This is the one that just knocked me on my ass. Only half of heart attack and stroke victims who survive prioritize lowering their cholesterol despite the connection between high LDL cholesterol and repeat cardiac events. That's staggering to me. Is the number of people who come out of a heart attack and keep on keeping on is essentially what that's saying, right?
It is staggering, and it's too bad. And again, I don't put this on patients. I put this on, I think, the whole system. We do a terrible job of communicating to people just how important this is for their health going forward. After heart attack or stroke, the most important thing you can do to reduce your risk for a second event is to stop smoking. By far, that is the most powerful thing you can do if you're a smoker. The second most important thing you can do is take medication to lower your LDL cholesterol and get it as low as possible. Those, if we could just get people to do those two things, we would prevent a whole lot of extra heart attacks and strokes.
It's interesting too because the man whom all this is named after, Dave Nemo, almost a decade ago had a heart attack, and he took it seriously. And he weighs less now than he weighed 30 or 40 years. He's in the best shape of his life, and he is now an avid gym goer. Loves to eat that fish. Often points out to me when I've had more than one hamburger a week what I'm actually doing to myself, and all of that stuff doesn't reduce the quality of your life, but it actually improves it. And you talked about the idea of the failure of the system. The other number that is really encouraging, simply by having you on the show today, every single listener now has a much higher percentage chance of actually managing and measuring their cholesterol. Simply hearing from a healthcare provider about the dietary, lifestyle, and testing necessities around this does have a really positive impact, doesn't it?
It really does. And, and you're pointing out some of the data that show us that. I would really encourage people when they are at their doctor's office to focus on the things that are important, especially if it's a wellness visit or an annual checkup. Doctor, are we doing everything we can do to make sure my blood pressure, my cholesterol, and my, lifestyle habits are optimizing, my health so that I will live as long and as healthily as possible? I think those are key questions. Remember, heart attacks and strokes are the leading cause of death in this country and in the world. We should be focusing on this a lot more than we focus on a lot of other things that are not likely to kill you. And so, I think these are important questions that people should be asking their doctors. Unfortunately, we have too small amount of time with our doctors, so focus on what's important.
And I wanted to ask you that question, too, because, once again, to kind of get back to the overall fabric of this particular show, we do a segment called Washington Trucking Week, where one of the things we talk about with these men and women about is how to be a good citizen. And I don't mean, how to behave in public. I'm talking about how to actually engage with their representatives, their representative staffs at the state, local, and federal level. It really is, you get limited time if you ever get a chance to meet anybody who represents you. And so it really kind of comes down. And this is an overall doctor question for you, Don. The question at the core of it is, what are the key things we should ask our doctor when we do get a chance to meet with him or her?
Yeah, I think writing down the questions that you have that come up, in the 3 or 6 months between your appointments so that you don't forget them. And always start with the question, doctor, what are the most important aspects that we need to control to ensure that I live a healthy, long life? And the doctor will then help you focus your questions to those things that, individually important to you should be the things that you spend the most time on, right? There are other things that, of course, are important on your list, but, I think, especially in these annual visits, getting your doctor to focus first thing on what are the most important things we need to accomplish today. And often those will be about lifestyle. They will be about blood pressure. They will be about cholesterol, because again, we want to sort of prevent the number one cause of death and disability, which is heart attacks and strokes.
Okay. So I'm willing to bet that simply ignoring the numbers is probably the biggest problem and the biggest issue when it comes to, this, the idea that, out of sight, out of mind. A lot of people kind of put it there and don't want to know, and that way they can keep on making bad lifestyle choices and, kind of living in the bliss of ignorance. But I'm kind of curious, what are some of the other big misconceptions that people have when it comes to managing their cholesterol? What are some pitfalls in your own personal management that people fall into?
Yeah. No, I think you're right. I think awareness of the issue is probably the biggest stumbling block, not getting your numbers measured. But I think people feel like it's going to take a massive amount of change to make an important difference. And that's just not the case. We know that if you do modest changes in your diet, modest changes in your physical activity that can lead to as little as a 5% weight loss, that will have very dramatic effects on your cholesterol levels. It can have dramatic effects on your blood pressure, on your blood sugar levels if you have diabetes or prediabetes. It'll improve your sleep. So many things can turn around and go well with, again, pretty modest changes to diet and exercise that lead to about a 5% body weight. So, I don't think people need to feel like, oh my gosh, I'm going to have to change absolutely everything I do. There are targets of opportunity, and talking with your doctor, maybe talking with a nutritionist, can really help you find those targets of opportunity.
I just wanted to tell you, by the way, and just to kind of let my listeners know about this, but I keep on beating this drum home. My father, at 80 years old, he's still with us. He was 80 years old, and he was 320 pounds. As of today, 2 years later, he's 260, and he lost that weight exactly the way you want him to lose it. Half a pound a week by cutting back on his salt, cutting back on his sugars, cutting back on all that kind of stuff. The biggest thing that we've all kind of noticed, Don, is that he has more vigor and vim for an 82-year-old man. To actually watch your parents at 79, 80 and think, oh, we're entering into the later phase, the mind is there, but the body's beginning to give, and to watch people rally, it really is never too late if you get there in time, right?
Absolutely right. And, it's sort of, one of those virtuous cycles, right? That improvement makes more improvement, makes more improvement. He starts to feel better, so he moves more. His knees feel better probably, right, while weighing less, so he can move more. And, he sees the improvement himself. So just getting started, small changes can actually lead to bigger changes over time. And, I think giving him all the encouragement you can to sustain that and keep going if he needs to, I mean, that's a wonderful story, and I hope you share that as often as you can.
Yeah, and by the way, Don, I'm going to tell you right now, a few things have moved me more than being away for 6 months, coming back home to be with him, and watching him actually get up out of a chair to watch the walker give way back to the cane, give way back to neither. Has been one of the great joys of our life. Guys, we have been so grateful to have Don here, incredibly busy. His research interests, by the way, include, of course, the study of life course and mechanisms of cardiovascular health, but also something near and dear to my heart, healthy aging and cardiovascular disease epidemiology, risk estimation, and prevention. He joins us here during, of course, Cholesterol Awareness Month. Dr. Donald Lloyd-Jones, thank you so much for making time with us on Highway to Health. Is there any websites or places you want to send people to make sure they get off in the right direction and the right start?
So great to be with you. Thank you for raising awareness of this incredibly important issue. Yeah, I'll send people to the American Heart Association's websites where you can learn an awful lot about all these topics. One thing I'll put a plug in for is something called Life's Essential 8, which are the 8 steps to making sure you have a full, long, and healthy life. And they have to do with diet, physical activity, avoiding nicotine, getting good sleep, and knowing your numbers on your weight, your cholesterol, your blood pressure, and your blood sugar. And just picking one of those things can actually make a dramatic improvement. So Life's Essential 8 from the American Heart Association. It's
kind of like Moneyball for healthy living. You got to know your numbers, and therefore you can improve your stats. Thank you, Don. You're welcome back anytime, man.
Thank you so much. Appreciate it.